This is 10 Minutes on Topic, and I'm Autumn Labbe-Renault. And today we're talking about Yolo County's crisis response team and co-response team. There's been a concerted effort over the last couple of years to distinguish between public assistance calls for crime or public safety issues versus those for behavioral or mental health issues. And there's been significant headway on the local front. Recently, our good friends at NAMI Yolo let us know about the county's crisis co-response team. With me is Robert Villarreal. He's an LMFT and the supervising clinician for the program, which is run out of Yolo County's Health and Human Services Agency. Robert, thanks for joining us.
Well, thank you for the opportunity.
Please tell us a bit more about how the crisis co-response team came about, and then we'll get into the details of how it works.
Well, this came about through a lot of conversations with our local mental health board, with NAMI, a lot of our constituents that our administration listened to and find out what the needs were. Law enforcement also voiced the desire to have more mental health contact with the clinicians being out there in the field. Law enforcement has to deal with a lot of different individuals out there. And as it has grown over time, there's a lot more mental health needs out there in the community. So to have the crisis response out there really stemmed from the community's requests and the administration's response to those needs.
Yeah. So how does it work? I assume 911 gets a call, and then what happens after that that would have that call result in a co-responder coming out instead of a police officer?
Well, so the response do initiate through 911 or the dispatch, local dispatch, when they identify that there is someone that is in some mental health or substance use crisis. Once that's identified, we do respond with law enforcement initially. We do go ahead and make sure that, because the main thing is safety is first. We want to make sure that it's safe for the individual, safe for the law enforcement, safe for the clinician. We respond on scene with them, find out what's going on, and then once the officers feel it's secure enough for the co-responders to really go ahead and take the lead, they go ahead and start to initiate that contact more so to find out what those urgent needs are, what the crisis situation is. Whether it's law enforcement out in patrol and identifying somebody that might be in crisis, or a phone call, the co-responder is someone that, again, that arrives on scene with law enforcement. There are times also when somebody's calling up in crisis that the call can be transferred over to the clinician if they're available.
Right.
So there's lots of different ways to act.
Yeah. How many responders are there throughout the county?
There are currently 5 responders. There are 2 in West Sacramento that are working 7 days a week. They are working 10-hour shifts. They are working from 11 to 9:30. And they, again, actually, we respond in our own vehicles. Each co-responder has a van, unmarked van, a white van, that they arrive on scene. They're on dispatch. They're on the radio so they can hear all the calls that law enforcement's responding to. And aside from maybe being specifically responding to those calls, they'll respond to anything that they feel might need a mental health contact. So we do have the West Sacramento clinicians. We do have a clinician in Davis that works Monday through Thursday, and we have a clinician that works with Woodland Monday through Friday. And then we just started with our clinician that works with Yolo County Sheriff's and the Probation Department, covering a large area.
Those are some long hours. Yeah, those are some long hours you mentioned over Yolo County, as we know, is geographically a very large area. So that's a heavy workload. So Also, how do the clinicians interact with law enforcement? I think what you mentioned about arriving in their own vehicles is pretty key because it sets the stage that this is a different kind of response. We are not the police. We are responding in a different way. Um,
True.
but I wonder what's the follow up after a call, for example, and the involvement between the clinician and the police. What happens after the response is made?
Well, and I think that part of it is with the co-responders, we want to make sure that there's a good relationship with law enforcement, that we understand that uh, what they need to do initially is to respond to those calls again to make sure things are safe. Once that
Sure.
situation is determined to be safe, is that we're there to go ahead and provide them services that they are generally not aware of for those
Hmm.
individuals that might be in crisis. We not only are there to assess if someone might be at risk of harm to themselves or others or can't take care of themselves, but we're also there as a bridge to help with any access to social services, help somebody connect to rehabilitative services for drugs and alcohol,
Hmm.
connect with APS, CPS. So we're actually kind of broadening the spectrum of services. It's just not necessarily mental health. And law enforcement, has really appreciated and embraced the services that the co-responders provide. And once we are on scene, we're an extension of what services they themselves provide, and are able to go ahead and follow up with calls because the crisis may not readily resolve right there on scene. We may be able to go ahead and de-escalate, but there might be some situations that continue on. And with the co-responders,
Sure.
we're able to go ahead and do those follow-up calls or do those follow-ups on scene once we establish some type of rapport with the individuals.
Nice. There's an aspect of this I really like too, and that's that families who have someone living with serious mental illness can actually contact the co-responders, contact the program, and let them know about their loved one's particular needs or situation in advance of something actually happening. And so that seems like a real key part of the program in terms of keeping people safe and kind of knowing the landscape. What comes next for this program? I realize it's relatively new, and you, as you mentioned, you're dealing with a relatively few number of co-responders and a large area. So what's your mandate for moving the program forward, and what comes next for it?
Well, it's a well-received program, especially through law enforcement, and we have the support of the various chiefs and the sheriffs, and the officers and deputies would love to see more with co-responders. And the city and the county itself is listening to this, and they are also looking at what moving towards a more evidence-based program. I'm not sure if this is been pushed more so towards the rest of the community, but it's a program called Crisis Now. It's a
Mhm.
model that's been uh, performing well throughout various other counties and states. It really focuses on not only providing first response when somebody calls up and is seeking services, and dispatch is
Mhm.
able to go ahead and triage those calls, but actually being able to go ahead and get law enforcement or a clinician, more so a clinician or a peer support worker, to eventually respond to those individuals, kind of taking law enforcement out of the the situation uh, once we determine it's safe. And then also providing a place for individuals to go to. There would be a facility where if somebody's in crisis, and not necessarily a psychiatric hospital or the jail is an appropriate place, but to go to a place where they can go ahead and get services and be evaluated for a period of time, overnight, see where things go,
Mhm.
and then make a better determination. So we're moving towards that model of being able to go ahead and hopefully prevent hospitalizations, incarcerations, taking people to the emergency room when they don't need to be in the emergency room, and providing them services in a more therapeutic environment. So that's where
Right.
we're moving towards. Yes. It's exciting. It's going
Thank
to
you
be a good
so
program.
It is, and it's really gratifying to see Yolo County takes this issue of mental health and well-being very seriously. And as we all know, the pandemic has done a great job of exposing
Mm,
the gaps in our
yeah.
safety net and also increasing the mental health issues among us. So, Robert Villarreal, thank you so much for joining us. Again, we've been talking about the Yolo County Co-Responder Crisis Team. And for more information, you can visit yolocounty.org. The URL for this program is miles long, so I recommend you visit the county site and type HHSA in the search bar, and you will be led directly to it. Thanks so much for joining us for 10 Minutes on Topic. I'm Autumn Labbe-Renault.
Thank you.